Welcome back, everyone. So, as discussed, we are in the second phase of family psychoeducation, learning survival skills to help cope with everything that's going on. Our last survival skills session was focused on learning about schizophrenia. Does anybody remember anything we learned last week?
I do. Well, schizophrenia develops for a lot of reasons, including environmental, genetic, brain chemistry, and maybe some substance use. There isn't one thing that causes schizophrenia.
And you can recover from it. Just because I have this diagnosis doesn't mean I will never be able to take care of my kids or work again.
Very good. You were both completely correct. Anything else?
Only 1% of the general population may be diagnosed with schizophrenia, but there's a higher risk when there's history of it within the family. But there's no history of it in our family.
Fantastic. Thanks for sharing what you remember, everyone. Today, I was hoping to address some of the anxiety that you have all experienced at home and work on some coping skills that might help everyone feel less stressed. Is that all right?
Yeah.
Yes, sounds.
Has anyone heard of the term expressed emotion before?
I read about it in one of those pamphlets you gave us about family coping with schizophrenia. It explains why Jane's symptoms are worse when she's at home.
Right. Simply put, expressed emotion is when emotionally intense and negative interactions contribute to increased symptoms in the family member diagnosed with schizophrenia. Psychoeducational family therapy can help build coping skills and shift those negative, stressful family interactions to create stronger, more helpful alliances within the family and decrease the level of expressed emotion. Can anyone think of examples of what might be contributing to the expressed emotion in your family?
Well, I get anxious when I have to be around everyone all the time. Like I said before, sometimes it feels better to be alone in my room or go out in the yard and pace around. Sometimes it helps to talk back to my voices, but when I do, everyone tells me to stop.
Well, I don't see how it can help to yell and scream like a banshee. It makes you look crazy.
Dad, we talked about that word.
She's not crazy.
Exactly, Carrie. Remember, everyone, when we discussed using strengths-based language,
Sorry.
you did bring up a good talking point, though, Frank. It can sometimes be helpful for Jane to manage her symptoms by talking back to them. It can also be helpful for Jane to spend some time alone if she wants to. Just imagine having symptoms like hers, having lots of voices at once telling you all sorts of things, and then having to sit at the dinner table or engage with family all at once. Do you see how that can be stressful for Jane?
I worry that when Jane goes in her room with the door closed, she's going to try to hurt herself. That's why I want the door open at all times.
I don't want to hurt myself.
And I understand you are worried, Allison. I hear you, Jane, that you aren't having any thoughts of hurting yourself. What do you think will help both of you feel better about Jane's safety when she needs to be alone for a while?
I can tell my mom I need to go in my room because I'm feeling bad, but I don't want to hurt myself.
Would it be okay if I checked on you once if you've been in your room for a long time?
Yeah, I guess so.
Well, how about a compromise? Jane can go in her room to be alone when she needs and close the door, but Mom can check up on you if it's been a long time. Does this sound like a good starting point to build some trust back?
Yeah, okay.
The next thing I want to focus on is increasing some of Jane's independence. Mom and Dad, I know you have been driving her to all of her appointments. Do you think it would be possible to get Jane a bus pass so she can get herself to some appointments? This will be a good stepping stone, and it will free up some of your time. I know both of you have been feeling overbooked the past few months.
Can we go with her the first few times she goes on the bus?
Jane, how do you feel about that?
That would work, I guess. I know they're both worried about me. I know how to take the bus, though. Maybe only the first time.
So one of your parents would take the bus with you to your appointment next week with your psychiatrist. After that point, you can use your bus pass to get to your appointments, and you can ask for help if you need it. What are your thoughts?
I like that idea. I do need help sometimes. Sometimes when my symptoms are acting up, I do worry about going out in public. It feels good to have someone help me every so often.
We can help if you need it.
It's important to empower Jane to be able to advocate for herself and feel like she has a hand in her own life and self-care. The more gradual steps we can take to support Jane's independence, the better. I'm glad you are all open to these steps. So, moving forward, Jane will be able to tell you that she's having a hard time with her symptoms and whether she needs to be alone or not. And Jane will get a bus pass to take herself to some of her appointments if she feels like she can. Agreed?
Okay.
This has been a great session, and I'm glad everyone's on board. Let's leave it here today and see how this plan is going next week.